Dr. McGuckin, how are you?
I'm very good, Dr. Jaffe. I've got a detective question for you.
Okay.
How does low magnesium and low antioxidants lead to diabetes, heart disease with it, and or the cardiovascular system and kidney problems as well?
Yes,
Putting those three together.
this is probably the most important insight and news, exciting news about the reversible causes of prediabetes and diabetes. We now know what to measure and what the measurement should be. And more importantly, the conventional tests of cholesterol and lipids and fractions and so forth are now outmoded. They've been outmoded by functional predictive biomarker tests with interpretation to the best outcome goal value, not just the statistical range that the lab uses. This is a paradigm shift. This means going upstream to personal primary prevention. So now let's unpack that.
Yeah.
Pre-diabetes is almost diabetes. This is like almost being pregnant. Pre-diabetes is a major risk factor, reversible with lifestyle, reversible with epigenetics, reversible with habits of daily living. Or you might now be in the diabetes range. If you look at commercials on cable, they want you to take a prescription for life that will get your hemoglobin A1C down to 7. I want your hemoglobin A1C to be 5. My hemoglobin A1C has been 5 for the last dozen or more years since I lost 65 pounds that I didn't need.
At 7, you're still going to have antioxidant damage, aren't you?
7 is an intermediate value. 7 is less than 8 or 9, but it is not the goal value. The goal value is 5. And with lifestyle, with proper supplementation and eating foods that you can digest, assimilate, and eliminate without immune burden. Having neurohormonal balance. Yes, there will be stress in life, but the stress doesn't have to wear you down. The stress can be helpful and what's called eustress. So managing diabetes, I will now quote my friend Peter. Diabetes costs, diabetes kills. Diabetes is a lifestyle choice. There are many people today preaching the message that diabetes is a disease that needs prescriptive solutions. It is not a disease. It is a lifestyle choice. It's about your habits of daily living.
How, how does the explain into the detail of the average diet is going to be not enough antioxidants and the bioflavonoids, magnesium, and how the blood sugar is then able to wreak havoc on those weak cells.
Well, the reason for the abnormalities in blood sugar have to do with impaired chromium and vanadium, impaired natures ascorbate, impaired polyphenolics, impaired magnesium and choline citrate, impaired many products that look like food today are anti-nutrients, they're pro-oxidative, they deplete the essential nutrients, they're not neutral. The average child today is eating half of this processed, ultra-processed food, taking beverages from plastic. So to just name a few of the pervasive harmful chemicals that are forever molecules like glyphosate and microplastic, solvent residues and toxic minerals like lead, mercury, arsenic, cadmium, and nickel, mold products in your coffee and your tea, Now, I advocate leaf tea, not tea bags, because tea bags leach another family of harmful chemicals.
Yeah.
So if you try to take these one chemical at a time or one toxin at a time, it's going to be crazy making. What I say is reduce by 80% your exposure by going with whole foods that you can digest, assimilate, and eliminate based on your LRA by ELISA Act test, so that you know what you can eat and tolerate, and not what would be eating you from the inside out.
So it's the nutrient depleted foods at the same time the chemicals in the food that are leading to the dysfunction.
Dual harm. Actually, multiple harms, but at least dual.
The dual, yeah.
And this has become common. There are roughly 10 or 12 companies that control all of this ultra-processed packaged goods. They don't even call themselves food companies anymore. They say we're packaged goods companies. We want long shelf life of our packaged goods.
Yeah.
We want our beverages to be cheaper than water. High fructose corn syrup, which is a terrible thing that I exclude from my diet entirely, but high fructose corn syrup is cheaper than water because it's an agricultural waste that's subsidized by your taxpayer dollars.
Yeah.
So the way to avoid harm is just to say no to anything that comes in plastic, anything that comes in styrofoam, anything that comes with a plastic wrap that is flexible, especially if the item is warm.
Yeah.
There probably is limited harm if the plastic is cold. But we now know for sure that from the flexible plastic wrap, chemicals migrate like vinyl chloride, which causes liver cancer, like heptachlor, like glyphosate, and on and on and on. Now, I'm a biochemist. I could go on and on. But the point is, I think you can avoid by 80% and then enhance through diet and supplementation your ability to thrive in the 21st century. And we've written this up, as you know, in our book, Thriving in the 21st Century, because we want people to know the intimate link between habits of daily living, risk of chronic illness like diabetes, and from diabetes and pre-diabetes flow cardio, respiratory, renal, liver, infrastructure, autoimmune, all of these consequences, which we now can, with evidence, link to an epigenetic, a lifestyle, a habits of daily living program that you can inform clients about. And today and tomorrow, they can be better. And yes, a hemoglobin A1C as one marker should be 5%, not 7, not 9. And you can achieve this. I'm just the personal face for this right now. I'm sure that you and your family are also at or about that level.
Yeah.
Because of the habits of daily living, the epigenetic choices that you make. Now, I understand that people want to make this complicated. And yes, there are lots of weeds that we could get lost in if you want, and some people want. But I can show you, because of our outcome studies, we have among the most successful type 1 diabetes and type 2 diabetes outcome studies. In just 6 months, we lowered people's average hemoglobin A1C by more than 1 milligram percent, which means we added 20 plus quality, low-cost years to their life. Their health span improved, their chronology also benefits. But I don't care what your age is on your license or on your passport. I care the functional age. And as you know, and I'll just mention again, I am functioning according to these tests, these predictive biomarkers and these self-tests, at about half my chronological age. And to complete the story, When I put this information in front of Bhante, a monk that I was very close to, at about 96 and 106, we measured him from stem to stern, and he came out about 40 years of age functionally.
Wow.
So I put this information in front of him, and he looked up and he smiled and he said, 40 is a good age.
I think what's changed is the volume of the plastic exposure and the chemical exposure. The small amount, it's at a young age, there's exposure, and that young age goes from 2 to 5 years old is now 15, and now we've got big problems, and it's spiraling.
Yes, absolutely. And the term turbo cancer, turbo heart disease, what you're pointing to is absolutely proven today, unfortunately. Younger and younger people are getting diseases that we used to associate with older age. We used to call adult diabetes. Now too many children have both type 1 and type 2, and there's even a type 3 diabetes, which maybe contributes to neurodegeneration and Alzheimer's disease. Alzheimer's may actually be diabetes of the brain, type 3 diabetes. So for all those reasons, we want your hemoglobin A1C to be 5%, and we can get there in a few months, 3 to 6 months typically.
Yes. Yeah.
If you have to get there in 20 minutes, I don't know how to do it. This is a marathon to be thriving, not just surviving. It's not a sprint.
And it takes about 3 months for the habits to change, and then 3 months for the weight to drop off. We've gotten dramatic weight loss by using the purified ascorbate vitamin C. It feeds the adrenal glands, and it curbs the appetite tremendously. They're not crazy.
Yes, nature's ascorbate is really wonderful. We pioneered producing this ascorbate under a nitrogen blanket so that it's fully buffered, fully reduced in all L form. And yes, the best news of all, your weight will tend towards what it should be. You should weigh about what you weighed in your young adulthood, in your early 20s. I can tell you that I am now at my same weight I was in my 20s.
Good. That's hard work. Good for you.
And yes, and most, since I lost the 65 pounds, I have been through what everyone goes through, which is called hormonal eating. This is, aside from stress-related eating, which is another problem, and there's a Japanese word that says, close the refrigerator, you're not hungry, you're stressed. And most importantly, the hormones called CCK and ghrelin, for a month or so, they pull you back into sugar, into high caloric eating, not low on the food chain, and healthful eating. I snack on seeds and nuts and berries and whole fruit. I don't fractionate oils. I don't cook with any oils or added sugar or any grains because they're too contaminated. Yes, this has happened within the lifespan of the full lifespan of people. This has happened within the last 50 years. And in that last 50 years, the sperm count of the average male has dropped by half after being consistent, after being constant for 100 years. In the last decades, fertility problems in women, equally rampant. Autoimmunity has been doubling every decade for the last 4 or 5 and shows no signs of falling, of leveling off. Uwe Reinhardt from Princeton University, a very famous economist, he says, just project forward one more generation, we will all be in hospital beds taking care of the person next to us. No one will be working or paying taxes. Yeah. That's not the future that I want. And you can be a minority today that chooses life and health. And yes, we've been at it for half a century or so, and are just getting started with the documentation that is coming in robust amounts now to show that what we have been saying for the last decades not only makes good human sense, but is practicable, is practical. You can enjoy life much more when you're lean than when you're heavy.
Explain a little bit how the magnesium is
Yes.
the thing that I see having the interaction with patients quite a bit on. With the absorbability, but also with the people with kidney problems, their demands for magnesium and the cardiovascular. But the absorption is I would like to hear a little bit more of an explanation in there.
Sure. We have pioneered how to triple, which means 300% increase in the magnesium uptake using choline citrate. What happens in the gut is that tiny little droplets called nanodroplets form that are taken up by neutral pores because the normal channel for calcium, magnesium, ATPase ion uptake saturates at 1/3. So 2/3 stays as magnesium in the intestines, never getting absorbed. And if you take enough magnesium, you will get the runs. You will have diarrhea. You will probably run to the bathroom and not like the person that did this to you. So we figured out how to combine ionized healthy magnesium with choline citrate, triple the uptake of the magnesium as measured by urine pH first after rest in the morning. And I can tell you that in our clinical study, we increased the magnesium from the lower half of the usual serum range to the upper half of the usual serum range. Now, magnesium is water soluble, so it can't go too high unless you have significant kidney disease. And if you do, we'll talk with your nephrologist. But yes, most kidney problems and most cardiovascular problems are due to magnesium deficiency. If you want ATP to work, you need 1 molecule of magnesium for every molecule of ATP. If you want your battery and mitochondria to work, you need magnesium and ascorbate, as well as CoQ10. If you want to have magnesium-dependent enzymes work, you need magnesium. Mildred Seelig and Dr. Ron Aline have kept the message of magnesium alive for decades. What they say is magnesium is the forgotten electrolyte. We have a relative excess of calcium. That's why doctors prescribe calcium channel blockers for blood pressure. But we have an absolute deficiency in magnesium. And when you get the magnesium in the cell up to what it should be, the calcium channel blockers are no longer needed.
Yep.
Let me be clear. You do not stop a medication while there's need for that medication. But when the need goes away by going upstream to personalized prevention, and you should be monitoring your blood pressure regularly and your pulse regularly. My pulse when I'm asleep is 50. My pulse when I exercise up and down the hillside of our R&D center goes up to maybe 110. That's pretty good.
Yeah.
That's what we all deserve. So thriving in the 21st century is a consumer-friendly explanation of what you're asking me to discuss. And I'm so glad to have you as a colleague of many years because of the way you communicate.
Oh, thank you.
Yeah.
When people have now the intestinal, the strength of the, I'll call it strength, it's actually the ATP, but the ability to absorb magnesium, when they say they can't, when they just get diarrhea right off the onset, even with the choline in use to aid the absorption.
No, it's okay to go slowly.
Yeah.
Probably what they have is a combination of maldigestion, which means they're not really digesting the food down to the elemental building blocks. dysbiosis, which means contraction of the microbiome and digestive helpful bacteria, a lack of elective production of mucins and secretory IgA, a lack of elective productive production of hormones and digestive enzymes that complete the digestive process. Leaky gut is a common term for this kind of problem. And then the worst of all, enteropathy, atrophy of the digestive capacity. So it's not usual, but it does happen that someone will start the magnesium and choline citrate and immediately the next day report, quote, loose stool or something like that. It's okay to go slow.
And
Instead of two capsules, start with one. Instead of a teaspoon, start with a half. Instead of twice a day, start with once a day. And help them rebuild their microbiome, their digestive capacity with our digestive quintet. The digestive quintet for just a month, and then come back with the magnesium choline citrate and it'll now get absorbed.
And that's where the LRA lymphocyte response assay test comes in to repair
the cell culture. The cells can talk to us in the laboratory, so we get T cell information and immune complex information, and we distinguish helpful from harmful antibodies. So you don't get confused and more with old physical chemistry testing. Serum testing is not immunology today. Immunology today means cell culture, and LRA is the gold standard of cell culture.
Good. Great. Fantastic. This is great information, and I appreciate the detailed how it's explained. So everybody watching, share this with your friends because this is really, really important information.
And this is new information. We have gleaned this information over decades. We have been practicing with this information for many decades. We are highly confident based on our outcome studies and testimonials that if you put us to the test, we will be worthy of the challenge. And most importantly, it doesn't take 20 years to see a benefit. In a matter of a few months, you can have a makeover in your bedroom, your kitchen, your personal care, your environment, so that 80% of the harm is avoided and the other 20% can be easily metabolized. You can stimulate your liver and kidney to get better. We have seen eGFRs of 30 go to 60.
Fantastic.
Which is more or less unprecedented.
Yes.
So we are highly confident that this personalized proactive prevention is really ready for prime time.